So I start with Britain. We have a problem with violence against women and girls. A few years earlier, on a visit to the Pacific island of Papua New Guinea, I spent time at a refuge which had been opened by a lady who was severely abused by her then husband. House Ruth, as it was known, in Port Moresby, had many women who had married according to tradition, and yet, contrary to all Papuan norms, they had been subjected to unspeakable torture. That experience tells me that gender-based violence is present in communities that have norms that espouse communal values. In the Pacific, what is known as Wontok, where everybody looks after each other, is a way in which the communities say that they care for each other. But there, in the heart of that community, we had this violence. Now, here in Jamaica, Ambassador Alun Asamba has openly talked about her personal experience of spousal abuse. And those who know her will see what I see, a formidable person of accomplishment. And yet she carried the legacy of abuse. She endured years of violence from her ex-husband, driven by unwarranted jealousy. And today, she exudes self-confidence and the joy of life. Now, Ambassador Alun's story tells us that violence is not a matter of social standing or wealth. There are cases of people who wear the cloak of religion and carry out acts of pure evil. There are many cases where pastors have been convicted of violent crimes against their spouses, and sometimes spouses have kept quiet, ignoring what is in plain sight. Studies have shown that the cycle of violence is self-perpetuated. Victims of violence can become perpetrators themselves, or at least aiders and abettors of violence. And so many victims fall into the trap of blaming themselves for the actions of others. A vulnerable person will excuse violence and stand by their partners. They say the man was under pressure at work. They say he's only violent when he's drunk. The simple truth is that whether the provocation is children, what's going on outside, violence against a person, male or female, is plainly wrong. Today we are supported by courageous and dedicated women who are prepared to speak out and take action. You have our support and that of the international community. International Day for the Elimination of Violence Against Women and Girls is being supported here in Jamaica by the United Nations, and diplomatic missions from India, Canada, Europe, and the United States have added their voice to ours. Now, much of the UK's work in Jamaica addresses violence prevention, and within that we have a special focus on the impact on women and girls. Throughout the world, particularly during this COVID pandemic, we've seen a spike in gender-based violence. And in Jamaica, we diverted some funds for general COVID mitigation. We set aside some of that to target specifically the impact on women and girls. I'm sure that in our conversation today, we will gain further insights on the challenges that women and girls face. We will also hear about how dedicated people are helping victims of violence. And I can tell you already that this event has made an impact before we've even started. Because as people were hearing about the event today, as they were signing up, a few ladies came forward to us saying that they were suffering from abuse now. Each of them are now in touch with people who are going to be able to help them and find a way out of a life of violence. So if anybody is listening today and is in an abusive situation, this is your opportunity to reach out, and we will ensure that help gets to you. Together, we will make a difference to our lives and the lives of our sisters, mothers, friends. That is our pledge, and that is our commitment. I thank you.
Good afternoon, everyone. My name is Christina Neal, the Policy and Research Officer at Women's Empowerment for Change, and I'll be your moderator for this evening. I'm both grateful and honored to be participating in this discussion with a few amazing women who have been active in the work towards what can be defined as a survivor-centered approach to gender-based violence and violence against women and girls for years. So this afternoon we have have with us Novia Condell. She is UNICEF Jamaica's health specialist since 2006. Her work focuses on improving access to healthcare for adolescent girls and boys, and she's also the focal point for the EU's Spotlight Initiative. We also have with us Joy Crawford. She's the executive director for E4Life, and E4Life is an organization that addresses issues including childhood sexual violations and gender-based violence and HIV. The members of E4Life are survivors of sexual abuse, domestic violence, and devout advocates. I also have with me here Dr. Elizabeth Ward. She holds many titles, but for this purpose, she will be on the panel in her capacity as chairwoman and director of Violence Prevention Alliance Jamaica. She holds a MBBS and recommends a public health approach to violence prevention. We also have with us the wonderful Joyce Hewitt, who's the acting executive director of Woman Inc. She has several areas of expertise, including HIV advocacy, gender equality, and human trafficking. She has made a name for herself as a consultant nationally and regionally, and she, as we mentioned before, she's the executive director of Woman Inc., which has a crisis center both here in Kingston and Montego Bay. And if you're an activist, you know that Woman Inc. is the only crisis center that we know of and that we recommend people to visit. So, women, thank you so much for joining me as a part of this conversation, a very important conversation that we need to have. So the theme chosen for this year's International Day for the Elimination of Violence Against Women is Orange the World, Fund, Prevent, Respond, Collect. And this theme was grounded in the heightened concerns around domestic violence. And when we talk about violence, we know we're talking beyond physical violence. We're including psychological, emotional, and financial harm across the globe in the wake of COVID-19. And we know because of COVID-19, there's been an increase in quarantining and isolation as a way of stymieing the spread of the disease. You know, when I first came into the realization of the theme for this year, I sort of chuckled silently to myself because I know that Jamaican women and the women on this panel have been engaged in the work of advocating for better policies and better laws for women and girls who have experienced violence. I know that women have been doing the work on the community level in terms of providing refuge for victims of abuse, even if it's their neighbor. And I know that also activists and advocates have been pleading to policymakers and legislators to do more work in terms of violence against women. So we've heard it several times before in the last 9 or 10 months that this is unprecedented times because of the pandemic, and it certainly has been. The inequities within our country and indeed across the world has become even more apparent, and the problem of gender-based violence, intimate partner violence, and domestic violence has certainly stimulated, I think, urgency to implement more safety mechanisms for survivors. According to the United Nations, global reports of domestic violence have increased, but we've seen the opposite here in Jamaica, where reports have said that there hasn't been a necessarily significant or noteworthy increase in domestic violence. And so I want to start off with both Joy and Joyce, who work directly with survivors of abuse. In the past 10 months or so, what has your organization looked like in terms of survivors or victims reaching out and the sort of support that they might have needed? Anyone can answer at any point.
I'm not sure you. Oh, okay, thank you. With regard to Woman Inc. and the Crisis Center services, one of the things that we have seen has been not necessarily what we would expect as a spike, as in other parts of the world, but what we have seen is maybe a difference in the type cases, whereby many of them are just more severe, or they're just not what we would consider as an ongoing practice that we would normally see. We see some differences, and we also have speculated as to why we're not really seeing the spike. And one of the reasons we suspect, we don't know, but we think that we will be able to do some further research once we get past where the virus is so hot and heavy. And that is that so many women rely on their cell phone, for example. And all too often, we might get a call at the crisis center, and the first thing that the woman says is, "Can you call me back? I have no credit." So we can just imagine for those women that we're not seeing come forward is that maybe they have no credit. And of course, we know that with the victim being in the household with the perpetrator, how then is she going to make a call for help? So those are two of the areas that we certainly work on. And we have a shelter, of course, as some people may know. We have one shelter here in Kingston. And we've had to, as a result of COVID, actually put in place what is already a limited, really severely limited space. We've had to put in place even further limitations with regard to how many women we can accommodate during this time.
Thank you. Good afternoon, everyone. You know, for me, the issue around the violence that my clients would have been facing prior to COVID, we knew that we were in a pandemic, a hidden pandemic of what's happening and the silence around it. And so for us, COVID has just amplified, and really it's almost like turning on light in a room where you had some insects, and once the light came on, everything became magnified. And that's been our experience at E4Life. We didn't go off. We didn't close. We made adjustments to match the COVID regulations. So we had our psychologists doing stuff on Zoom and Skype. With that, we had to increase, of course, the creative, getting more devices to make sure that we're doing remote. But we had an increase. We had there was a need for food security. So we had to mobilize food and, get it to all the parishes, because we're in Kingston. And I know that we got to a point where every Saturday morning, every 2 weeks, we had a truck that left Kingston, and the driver stopped in St. Anne, he dropped off, then he went to Montego Bay, then he went to Sav and did a circle. So we were really very busy mobilizing and reaching out to our partners to make sure that we had food, because the first thing was we needed food. We saw that a lot of our clients are in an informal income sector. They were the women who would be buying and selling, or, juggling, as we call it in Jamaica. And even when the government did the relief, they didn't benefit because a lot of them didn't have TRN. They weren't in any bank space to get anything. So there was a whole another group of women in Jamaica who just didn't benefit from that. There are two other things that we saw. Was the issue around homeschooling. Our clientele would be the young teenage mothers. A lot of them didn't finish formal education 12, and they were now placed at home to become teachers. So the frustration, they're in rural Jamaica, there's no data, there's no device. And so a lot of my children between March and summer never went to school. So I just think that what I saw happening, I keep saying, is that the most vulnerable of the vulnerable were not planned into the response, were left behind. We saw one, I don't know if I can say it's a good thing, it may be a good thing. The girls were locked at home and we saw the increases. So for us, because we have a pool of clients who were our structures all the time, so we had access and we saw. But by the time we got like mid the crisis, like about June, July, and coming up now, we saw a dynamics where the men, some of the men who usually commit the acts and leave, go down to the bar or go check him friend, wasn't doing that. He was still at home. And we have a few of them who've looked in the mirror and are now accessing counseling. And I know, like this morning, I was in another space and one of my mentor moms was sharing that she now have a young man who calls her to say, listen, I'm getting angry. Can you help me through it? So in a way, there has been an opportunity for a couple of the men who are now seeing, I guess, the ugliness. Right. And so they are now saying, hold on, something isn't right here. So that for us is a little glimmer of hope. So that's been our experience, but we've been everything for us has been magnified. We need more of everything. We need more counseling. We need more of everything right now. Right. And because the cracks have been deepened by the COVID pandemic.
And one of the things that, having done any sort of research into domestic violence and what that means for women who are victims of abuse internationally, is that because of the measures that have had to be put in place, isolation and quarantining, where now victims are now with their abusers for long-term periods, whereas previously, some of them might be able to tell a friend that something is going on, and then even for young children who are victims of abuse, sometimes school, a teacher might recognize that something is happening, or a guidance counselor might recognize that something is happening. And so I want to turn to Novia, who does a lot of work around adolescent girls and boys. What has the landscape been like for adolescent boys and girls in Jamaica in terms of violence and experiencing violence?
The landscape is much like what Joyce and Joy have explained. Mm-hmm. There is that cutoff from school where young people, it's sort of a pathway to help for a lot of our children. So if I'm home and my abuser is at home, I don't have a phone. Who am I going to tell? Mm-hmm. If I tell, I may have disclosed to an elder in my household who does not want this to reach the road and is very interested in keeping it a secret. And so I am at increased risk. In fact, the National Family, the CDA, new CDA's name, CPFSA, that one slipped me. The Child Protection and Family Services Agency has reported a decrease in reporting, and we can tell that that is because children are not in the spaces that they are. Exactly, where they can access the help. So we know that there are some issues there. I remember earlier as well in the pandemic, there were stories coming out of health facilities where children were turning up in numbers because of damage to their bodies, because of abuse. So we know that the issue is there. We understand that there's an interruption in that pathway to help for a lot of our children in this country.
Right. And as the conversation progresses, because I think all three of you have made some really excellent points that I'd want to touch on further, especially as we think about response, what response looks like, what prevention looks like, and most importantly, what accessibility looks like for the people who need this sort of work. Now, when we think about funding, I want to move into the funding aspect of the theme. Now, funding is a major issue, especially for NGOs. And we know that NGOs, I think, carry the burden of responding to the issues of violence against women and girls versus the responses that are available for or well provided by the government. And we know that funding opportunities have been limited, and they can be limited, right? So it can be either limited to a specific kind of work, or funders can decide that one day they no longer want to invest in this particular thing. So I wanted to find out from everybody, even if you know, have you noticed any sort of increase in funding opportunities given the pandemic? Any sort of funding opportunities for this specific kind of work? I see a very interesting look on Joy's face, and I'd love to find out what that look is.
Well, actually, I think we should talk about resources and not necessarily funding. We didn't get an increase of funding, and we still not see the silver line yet, but I must say we did get an increase in resources. We reached out to a number of private sector organizations who came on board and provided us with the number of food supplies that we needed. We had private citizens who reached out to us and supported us in getting our masks and that kind of stuff. The UN entities, PAHO, we did mobilize the COVID packages. And so I think we were able to increase the resources that were required to keep our families afloat. The money part of it now is very missing.
Very much missing. So one of the things when I think about funding, and as Joy rightfully said, money is missing, especially for a lot of non-governmental organizations who don't have an income coming in every month or every year, right? We have to rely on outside funding. So when I think about that and I think about our ideas for way forward, I'm now thinking about what does a sustainable model look like, right? And I want to pose it to everyone here on the panel. How can we think through a sustainable model, one that can really allow us to generate the resources that we need? And we know when we say resources, we mean money, we mean people, because we need people to be doing things. We need capacity building. So what do you think a sustainable model can look like for us when we're talking about violence prevention?
Yeah, I think we approach it as an alliance that all of us have to work together. And one of the key driving factors for us is the data and how we use that data to effectively manage. I know that we do have an overall national plan of action for gender-based violence, and we do have a national plan of action for prevention of violence against children. These are comprehensive documents where agencies are all identified and their different roles are there. And these programs have been costed and they are in existence. What I think is, though, there are some gaps. There are some immediate gaps in terms of, as Joy was saying, the critical vulnerable groups that we need to have a special track of action. But we need still to be guided by the data. And we also need to ensure that we are using our creativity with that. We've been able to, through some funding that we've gotten, to come up with a mechanism to pull different data together, which is called SAFER. And also we have, so you look at education data, you look at food supply, poverty, all the different risk factors, and come up with some sort of prioritization or at least data for analysis for everybody to be able to use, population, age distribution, and things like that. And also we've been able to strengthen with the Ministry of Health the Jamaica injury surveillance system. And what has been very worrying is that when we looked at somewhere like Spanish Town, we saw that there was a shift in the data from being on the street into the home. And just as Joy said, it's more serious violence that never used to happen in the homes. So you're seeing more stab wounds and more serious injuries coming in. So while the numbers of women per se at the hospitals have not gone up, we were initially seeing more serious cases. And what is worrying is that the children are in the homes, and the children are being victimized because they are affected. So I think the other issue that I think is when people come to us, that we still are able to provide them with some hospitality, whether they turn up at the police station or whether they're coming into an hospital. And I was with the Nursing Association. We have, 6,000 nurses across the island. Today is their Orange Day for ending violence against women and children. And they were talking about every child counts. And all of them were looking at how do they respond, how do they have a care plan. And then I was also talking to one of the regional guidance counselors, and she says they have a network, and there are 25,000 teachers, and those teachers, the majority of them, are female. So, I mean, we have mechanisms, but the thing is we are not necessarily providing meaningful support and training and specialized interventions when they do really run into the major problems. But I want to talk about the men. I really, and you want to talk about them too. Okay. It takes, you want to do it?
Award goes on to the men.
Okay.
It's a very, very critical piece of this discussion. I wanted to talk about the funding, and I wanted to just really highlight, yes, do we have enough funding to address GB? We absolutely do not. However, what has been, I think, sort of a landmark, certainly in the last couple of years, is the Spotlight Initiative, which is an EU-funded initiative that has brought 500 million euro to this issue across the globe. It is really the largest funding ever dedicated to this issue. And Jamaica has benefited as well. We are working. We're not moving quickly enough, clearly, for the issue. It's burning in the fields. But Jamaica has benefited to the tune of 10 million US, an investment from the European Union, working with the UN and working with civil society and the government of Jamaica to address the issue through 6 different pillars, looking at strengthening capacity of our civil society organizations that largely work without resources, and we're looking to hopefully build that capacity, looking to working on legislation, looking to work on institutional capacity building. As Dr. Ward was outlining, a lot of work needs to be done with our government counterparts, or looking also at changing social norms around the issue, which is a huge undertaking, looking at how we are building capacity for those services that women need, expanding the places women can go for shelter, for help and support. So it is a very large undertaking. It's a 3-year investment from the EU, and so yes, we need to be working on sustainability and to really see what we can leverage from this support. COVID has set us back tremendously, but it has also given us some opportunities, and so we are very pleased as the UN family to be working with the EU family on this initiative.
So much, Novia. Let's see where you're going.
I would really like to say that it's like a bird. It takes 2 wings to fly. And having worked some time in private practice, and you try and get a woman who is in an abusive situation to leave that situation, and besides putting out the best care plan that you can, you find that woman is still in that relationship. One of the things that has been advocated is that when we do counseling, that we are making sure that both the men and the women are counseled. We did something called Peace in the Pandemic, and one of the things was reaching out to men. We bring up our men, they can't cry. They're punished more than anybody else in the society by their mothers, right? And they have grown up in a cycle of violence, and they often perpetuate this violence into the relationship. And there's a power dynamics, there's a financial dynamics. Do we teach our people how to manage money, how to agree on building relationships? How do we associate with the impact of all the severe economic challenges and social challenges that this epidemic has come about? And one of the things the men said to us, they have nowhere to go. They have nobody to talk to. They're not allowed to say that they feel or whatever. And these emotions boil up. And so while we know that the burden is very, very heavy on the women, we need to look at it in a bifocal way and ensure that there is a role for the men, and we encourage them and make sure that we work with them over time. The other issue is when we spend our money, we need to make sure we're putting it against effective programs. And I'll tell you, well, as somebody put it, a cautionary tale. In Nicaragua, they decided to put out the most amazing gender-based violence program. They had police women and police stations that were only run by women just for the women to come. They had shelters, Mi Familia, that were there. They had education of how women should be able to stand up and stand up against violence and things like that. And you know what happened when they evaluated the program, which looked picture perfect? That those women were actually, that really received the services were experienced more gender-based violence. They didn't reach out to the men. So it's just a cautionary tale, and we need to go through our programs. We need to look that we have an effective data collection system that measures the impact, measures the cost benefit, and measures the cost effectiveness of our programs and the sustainability of them as we go forward.
Joyce, go ahead.
Yes, I'd like to follow on what Dr. Ward is talking about with regard to working with the men. And for Woman Inc., even though people still say the Women's Crisis Center, at least 20 years ago, we changed the name and made it the Crisis Center. We have men who work on our hotline, which, by the way, is all volunteers. We train men to work on the hotline in the same way that we train women to work on the hotline. We have a relationship with many male police across the island who are trained in domestic violence intervention. Certainly major gaps still exist, and that's one of the areas that we need to address. That's one of my dreams. But certainly we need to be sure that when we're talking about programs for men, that we include men as facilitators. And that is one of the things that Woman Inc. has done. We had a study that was done nearly 20 years ago just to determine what was the attitude, not only of men towards violence against women, but what was the attitude of women towards violence against women, because a lot of times women also see it as their lot, and we have to address every aspect of it. But in doing this particular study, looking at the attitudes, the researcher at first was really feeling distraught when she got the initial data, and she created really what was an abstract. And the abstract said, and God created man, ... and women as an afterthought. And the result of the initial survey was that men felt that they had a God-given right to abuse women, to keep her in her place. However, based on that, we developed a program, and we still to this day have that program at work, which is called Men Let's Talk. And it was really our counterpart in Montego Bay who came up with the title, and mainly also because we have more male participation there at the moment than we do in Kingston. But the bottom line was that we developed that program, and we began to have male facilitators only, so that we, to this day, send the men out to conduct for men only seminars, workshops, and they do find that there is some movement in terms of how men think. But the major gap is that we just don't do it enough, coming back to what Joy said about resources. We did it maybe twice, last year and year before, and we did it to the point that at one time we had about 40 young men in a room, mainly from tertiary level institutions, and some of the things that they came out with were absolutely disturbing. And they were so disturbing that we decided to take the information that came out of one of the workshops and to then develop it into a questionnaire for women, and to use it as a true and false, bringing the same women from the same communities, and then allow the women, not giving them the information that these kinds of questions came out of a men's particular workshop. And to find that the disparity in terms of approach, in terms of expectations, is one of the key things that we need to look at when we're looking at male-female relationships. The program has promise, but again, the resources are something that need to be included. And we need to overall have what we call budgeting. We need to have a budget in the same way that we have a budget for transportation, we have a budget for health. We need a budget for addressing these issues of domestic violence.
You have to let me to the men. I have to talk about my men. So for us, I mean, I'm extremely proud. Like now, there's a parallel discussion going on at the National Family Planning Board. And they invited the organization to be on the panel to talk about men involvement. We have a male volunteer. He is one of our, what we call our Nogada ambassadors, a community man who is sitting on that panel representing E for Life. And so for us, that is major. So we, over the last 3 years, have been working with community men. The men who you would not necessarily find thinking that they would even go to a workshop, the man on the corner. And out of that, we now have 47 Nogade ambassadors, of which 90% are male. All types of men, young, old, name it, they're there. And what I like about this, and these are from over 8 parishes, 24 communities. But what struck me is that they have sustained their program. They have a WhatsApp group, and I'm a fly. My staff is fly. They are the ones who run the group. They are the ones who let me know what is in the media. When somebody does something to a woman, they are very vocal. They are the ones who are saying we need to have a forum. It's a long time we haven't bring the community together. They are driven. They are the ones who will say, they have created their network within. Who will know to report and who go and call the police. Very, very powerful outcome, but what I like is that they have sustained it. And I think the trick was for us, or the method was, we really sat down to debunk this thing about toxic masculinity. And that it is not, you can be transformed. and not to use it as a reason to continue a particular behavior, but to say no, as a human being and as a male, you can make decisions that go against this thing to say it's just so you stay. And they have been extremely powerful. They engage their communities. They partner with us. If the girls and the survivors, we link the survivors with, if they're going to do a community intervention, we go together. But it's a powerful group of men. Like Joyce said, I would love to see how we can develop them, you know? And so there is a place, and I think all of us who are doing the work recognize that we need to have this piece. Now, it's how do we now get, you know, like I said, have it on the agenda of the donors and all to ensure that there is a specific place, and how do we help our men in it. So they're the ones who say to their friends, no, go there. So I'm very excited about that.
I'm really happy that both you and Joyce have brought this up. I'm very interested in this program because one of the things that I like to mention whenever we're having conversations about violence against women is that the work needs to be done in terms of the people who are perpetrating violence, right? And so we have to include men in the conversation because we know that men are more likely to listen to men. So having men as a part of the conversation, if we're looking towards response and prevention, is really important. And I wanted to add, you know, while I agree with Dr. Ward in terms of how we have curated masculinity in Jamaica to sort of ensure that men and boys have this hard exterior all the time, I want to add as well that we've also created a masculinity that tells men that they have ownership and control over women's bodies, you know. I cannot tell the amount of stories that I've experienced, that I know other women have experienced, of just being on the roadside and a man thinking that it's within his right to violate your body, you know, just because he thinks you look good or because, you know, he wants some sort of something from you. So that's also the added part of it. And I wanted to, before, because I think we're running out of time. Sure, go ahead, Dr. Ward.
Things I think, though, that we really do need to look at is we need to look at providing some microfinance with gender equity, because the economic dependence of women is one of the things that really makes them vulnerable, and we need this grassroots funding, and I think somewhere like Spotlight needs to look at it. We have evidence from all across the world, how it works, how it helps, and it reduces the vulnerabilities of women. So I would like to say, from an evidence point of view and from a cultural point of view, this is something that we need, especially in this time of COVID, where resources and finances are, and all the informal sector and tourism sector, all these sectors are no longer providing us with resources, but the needs are still there. We need to get in there effectively using our networks and get it on the ground and put gas on the delivery system.
I'm really glad that you said that, Dr. Ward, because you basically answered several of my questions. But something that was mentioned earlier that I'd really love to go back to, because it ties into this idea of response and what response looks like. Now, as all of you would have experienced, working with survivors and hearing from survivors, we get a lot of stories about their relationship with police officers when they go to make any sort of reports, because police is usually the first point of contact when they're looking at justice and safety. We hear a lot of stories of re-traumatization, of victim blaming, and just police officers not being as sensitive to the issues that women are facing. And I know that some work is being done by a lot of NGOs to sensitize police officers in terms of human rights. But I wonder, and it's something that We Change has been talking about a lot, about alternative first response. All of you have mentioned the importance of community, and I do believe that women in communities are excellent points of contact when we're talking about violence against women, and I'm glad that a lot of you, in terms of your organization, are doing the work in terms of going into communities and starting programs there, because if we want any sort of social change, if we want any sort of change in the psyche of people, then it needs to go with the community. And so let me skip down a little. So when we're talking about response and prevention, Dr. Ward rightfully mentioned that we need to go into the grassroots communities. And I can ask you, Novia, since you brought up Spotlight, is there any intention, or have you already started doing work with grassroots communities in terms of helping them, the people within society, community leaders, to really move forward in terms of responding to violence, conflict resolution, etc.?
Absolutely, that's a part of the plan. Pillar 3 in Spotlight looks at changing social norms, and that only happens at community level. So thus far, we have selected communities based on data in three Spotlight targeted parishes. We're looking at, it could be 4, Kingston, St. Andrew, St. Thomas, Westmoreland, and Clarendon, in fact. 4 parishes looking at targeting communities with a high rate of domestic violence in those communities, as well as violence against children. As we know, this is a life cycle thing. Dr. Ward mentioned that our boys are raised with such harsh punishment, and the data has shown us that if a boy grows up in a home where he sees gender-based violence, he is more likely to become a perpetrator. If a girl grows up in that environment, she's more likely to become a victim. So we know the importance, the link between violence against children and gender-based violence as our young people grow up. It is a life cycle approach. So in the communities, we're taking the approach of parenting, addressing parenting, improving how parents understand gender, because that is an issue. Also, looking at engaging men in our communities as facilitators. Men are not just perpetrators, and so it's really critical, and I think Joyce and Joy raised it, how important men as facilitators, as sort of link. Conversations. Absolutely. Getting the issue out, giving it some ear and talking it through with their peers, how critical that is. And also working in schools and within different community groups. So yes, that work is being done largely through some very competent CSOs, civil society organizations that we have here, working on different elements of addressing gender-based violence at community level. Really and truly, a lot of experience is to be had in Jamaica on the issue, and so that we can begin to sort of spread the knowledge around and spread the work around, and making sure that we touch on the issue at that level.
So as we're winding down, I have about 2 questions left, and I do want to pose the first question to both Joyce and Joy, because they work directly with survivors. Joy, in terms of, so when survivors come to you to seek help, what do you find are the overriding needs of the survivors? Like, what is it that they immediately need when they come to you? Especially as we're thinking about creating sustainable frameworks, we need to understand what victims need and not what we think the victims need. So talk to us a little bit about what you've recognized as the primary needs that victims have when they come to you.
I think, and in our experience, the first thing that they need is love, safety, and security. Again, this morning, one of the survivors shared that when she came to E for Life, the first thing that she got was a hug. And that hug has stayed with her for the last almost 8 years. And I think that's what makes the work happen for us. We've created that safe environment, that safe space, the family unit that they are not having. They are being treated, you talk about the survivor-centered approach. There's non-discrimination. There's respect of their autonomy. There is, of course, the issue around how do we see them as whole. We facilitate their growth. And so I think that's what they need more. I think if we can provide our survivors with a comprehensive safe space where they know that their needs are prioritized, we will have them transformed. Because if you can't reach them, I think Elizabeth said it, that, when they approach the first responder, that could just make a big difference.
Right.
And so for us, we place that very high. The environment in which they come, once they're there, then we can do just about anything to serve them.
Joyce?
I wholeheartedly agree with what Joy is saying. And for us, it's a matter of really and truly restoring that sense of self-worth. The fact that all too often women who are victims and who are moving from victimization to survivors are really generally feeling less worthy. They are made to feel over time that they have no value. So restoring that sense of self-worth is a critical aspect, and it is also among the first steps towards healing, and among the whole idea of really centering on the victim is that you want to promote that healing, and the process that you give them, what you provide for them, is that sense of security and the hope and the faith that they can have in you, because you're going to be confidential, of course. And once they begin to trust, because all too often their trust also has been destroyed, so that once you're able to get them and start to promote that healing process, that is the road to victory. It is not an easy road. Many times, just like any other psychological aspect, is that you may go forward and then there's something that may trigger the negative aspects of what has occurred, and you go back again. But it is a matter of just allowing them to have that space and to move them forward in a healing process. And sometimes it is not the panacea as such, like it's not a one-size-fits-all, because it is different for every woman. And that is why one of the things we stress is that each case is treated on its own merit, that we never ever think that we have all the answers, because a lot of times it is the victim who has the answers, but they've never been just given the opportunity to think for themselves or the support. And so it is all of those things. It's a combination of things that is required, and it is a very complex situation. One of the things that occurred to me as we were talking about women going to the police, for example, we need to understand that the majority of women go through a process, and that process of seeking help, by the time they approach a pastor, by the time they go to the police, by the time they go to the family court for assistance, they are at the end of their rope.
Yeah.
And generally, it is a matter of years, not just months, but years,
Absolutely.
that they have been subjected to all
Absolutely.
forms of violent situations. And that is where we need to recognize the need to address all aspects of her survival.
All right, thank you so much. And I want to thank my panelists, my very competent, brilliant panelists who have been doing this work. Thank you so much for having this conversation with me. And clearly there's so much more that we need to do and so much more that we need to talk about. And I hope we all continue the work. Thank you.
Ladies and gentlemen, the European Union is pleased to join in today's observance of International Day for the Elimination of Violence Against Women. Around the world, 1 in 3 women have experienced violence in their lifetime. In Jamaica, it is 1 in 4. Since the outbreak of COVID-19, indications are that all types of violence against women and girls, particularly domestic violence, has intensified. We must include violence against women in COVID-19 response and recovery efforts. The European Union has put up €500 million to promote, together with the United Nations, a global partnership called the Spotlight Initiative. 50 million of this amount is to address family violence across the Caribbean. The Spotlight Initiative is our demonstration of commitment to ending this human rights violation. Let this day be your call to join the efforts as we work together to end the violence now.
Hi, I'm Chargé d'Affaires John McIntyre. On behalf of the entire U.S. Embassy community, I hope you join us as we commemorate the International Day for the Elimination of Violence Against Women and kick off the first day of 16 days of activism against gender-based violence.
Violence against women is a global challenge in both public and private spaces. Preventing and responding to violence against women and girls requires all of us to take action. Governments, individuals, faith leaders, the private sector, and civil society.
Violence is also a pervasive barrier to women's economic participation. Making sure women are free from the threat of violence and enjoy equal protection under the law is essential to a country's prosperity and sustainability.
Every woman deserves a life free from violence. Today, the United States reaffirms its commitment to eliminating violence against women, and we call on our partners in government, the private sector, and civil society to work together to take immediate action.
As we recognize the 16 days of activism and the International Day of the Elimination of Violence Against Women, Canada reaffirms our commitment to end gender-based violence, not only in Canada, but around the world. In Jamaica and around the world, Canada is taking the lead by supporting women's organizations to advance gender equality through the Women Voice and Leadership Program and with initiatives such as the Canada Fund for Local Initiative to further support the work of grassroots, local organizations, and networks to address the root causes of violence. Now more than ever, as we observe these 16 days of activism within the context of COVID-19 and the associated stay-at-home measures introduced to curb the pandemic, we must increase our vigilance and do all that we can to protect women and girls who are at risk of violence. I encourage you to take action during this year's 16 days of activisms and beyond to end gender-based violence. Let us respond, prevent, protect, and play our part in ensuring a safe and just world for our women and our children.
Crime against women, including domestic violence, abuse, and rape, has been a part of our society for all times, unfortunately. And we are speaking not just about 50% of the human population, but of those who we live with and who we are heavily dependent on for the welfare of our families. We are mothers, daughters, sisters of men in whose hands we suffer unacceptable humiliation and abuse. Not that abuse from a stranger is more acceptable, but when it comes from people who we live with and who we nurture to make a home with, it crushes the very core of our emotions, much beyond physical hurt. Today is the day to remind ourselves that as women, not to accept and tolerate any form of abuse. Help those who have unfortunately become victims and speak up, not just for ourselves, but for those without a voice. I would wish to encourage ourselves to continue this campaign, not just once in a year, but on a daily basis wherever we are. Thank you.